When doctors and nurses who treat military members and their families make serious or deadly mistakes, we've learned their identities are often being kept a secret. Factfinder investigator Josie Sturman reports why.
Just 12 days after his first birthday, Zamari Reese was supposed to get ear tubes and have his adenoids removed. The surgeries at Walter Reed Medical Center were supposed to be quick and simple. They weren't.
This was him the morning of his surgery, and this is how they returned him to me.
A lawsuit filed by his family against the government says Zamari's doctors knew he had medical conditions that put him at risk. He came out of surgery suffering a permanent brain injury caused by a lack of oxygen after military doctors carried on even as he struggled to breathe and his heart failed. Now 8 years old, Zamari is wheelchair bound and requires round-the-clock care from his mother, with a judge awarding the family millions to cover the cost.
No amount of money will replace what they took from my child.
Our national investigative team analyzed the numbers from an annual report made to Congress. Since September of 2009, we found nearly 1,500 medical malpractice claims solely from the military system have cost taxpayers almost $1 billion.
That tells me there's a very significant problem with military medicine that needs to be looked at and addressed.
That annual report to Congress doesn't name names. In the civilian world, though, malpractice judgments are often included in a doctor's profile on state medical board websites anyone can access. But that's not often the case for many military providers.
Right now, the secrecy isn't really helping anyone except for people who are bad actors.
Steve Ellis with Taxpayers for Common Sense says the malpractice spending raises big questions Congress should be asking about military health care quality and transparency.
And the government should be putting this information out already. It's embarrassing.
Since May 2022, we've filed 9 Freedom of Information Act requests with the Defense Department and Defense Health Agency, as well as the individual branches of service, asking for malpractice and discipline information. Our requests have been repeatedly denied.
Why are they hiding it? Because it's bad.
After the threat of potential action from our legal team, we were finally given data never before seen by the public. It shows that between 2018 and 2022, there have been at least 478 military medical providers reported by the Department of Defense to something called the National Practitioner Data Bank. That's a confidential government repository that houses disciplinary records and malpractice judgments against healthcare professionals across the country. It includes cases involving misconduct and mistakes, even injuries and deaths. But service members and members of the public can't see who's in there.
How can you have that many incidences and that many problems and that much cost? The scarier part is, who are they?
Our information requests asked for the names of military providers reported by the Defense Health Agency. We didn't get them, but we're continuing to fight. The agency wouldn't do an interview and did little more than cite federal code when asked why discipline involving problem military providers is kept secret from the service members they treat.
My husband put those boots on before my son's injury, and he continued to put those boots on after.
Although her husband has ended his service to his country, Tamika Harris Reese is soldiering on with the task of caring for their son. Zamari Reese, another casualty of military malpractice.